Hi, I'm Dr. Jack West, and I'm a medical oncologist with a focus in lung cancer at the City of Hope Comprehensive Cancer Center in the Los Angeles area. I'm also the founder and serve as president of Global Resource for Advancing Cancer Education. And this is another one of our series on COVID and cancer. I'm very happy to be joined today by Dr. Benjamin Levy and Dr. Jared Weiss. So let me turn it over. I'll have Dr. Levy introduce himself.
I'm Dr. Benjamin Levy, and I'm Associate Professor at Johns Hopkins School of Medicine and the Clinical Director for the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial in Washington, D.C.
And Dr. Jared Weiss.
I'm Jared Weiss. I'm a medical oncologist specialized in thoracic, Associate Professor of Medicine at UNC, Section Chief of Thoracic Oncology there, and Vice President of GRACE.
I suspect that we all come out in favor of telling people or trying to convey our support for getting vaccinated. I do have a patient or two who have not pursued it. And, you know, we have to walk a fine line. We want to support what we consider to be the best approach to whatever extent the evidence suggests, but patients have autonomy and we don't want to alienate them over this. So I'm interested in, maybe I'll start with you, Jared, just whether when you have a fundamental difference, is this something that you feel that you are an influencer changing a mind about this, or whether this is just, you know, like arguing about one of these big, major sprawling issues like, you know, abortion rights, and you're not going to come to terms and change a mind in the time that we have for, an oncology appointment?
So I think this comes to the heart of what Cancer Grace is, right? We're here in this organization to provide education to patients, ideally with the goal of the right thing happening. It's very much the same in the office. It's not our job to tell people what to do as a final end. It's our job to educate patients and provide frank advice to them, right? For years, we've been telling people to quit smoking, and nicotine is highly addictive. Coronavirus is not. So you know, this is not a totally new territory for us, the idea of educating patients. And my experience is that we are, as a system, yet you spoke earlier about mistrust, and there is an element of mistrust of big pharma, mistrust of government. Actually, I think that oncologists are a very trusted class. We have very close relationships with our patients. We've been battling to reduce their suffering and keep them alive for months, or in some cases, years. I think it's a very close relationship with a lot of mutual trust. And my experience has been to have a lot of patients, actually, and families who were initially very opposed to vaccination, very afraid of it. And then when I provide information to them and I say, I got vaccinated the day I could get vaccinated. I got my wife vaccinated the day she could. I have all three of my young children on waiting lists to get on trials to get on vaccine because I'm desperate to get them vaccinated. They say, oh, okay, can I get vaccinated here? I mean, it's like flipping a switch, right? And I think, you know, all of us have worked very hard to earn that trust. We are honest with our patients. We do provide quality information for our patients. And now in this context, it's just wash, rinse, repeat.
Well, it's interesting. I think you make a couple of great points. One about our goal isn't to drag people kicking and screaming to do what we want them to do. We want them to have the knowledge that we think they should be equipped with and make a decision for themselves, and also to say, here's what I do and here's why. And that's always been, you know, a way that, particularly with complex questions, we still rely less on computing a formula than what would you do if it was you or your family. And that's the way brains are, you know, they operate at an individual human kind of story level. And so I think that that's still the case here. I'm impressed that you are influencing folks. Ben, what's your experience been?
Very similar to Jared's. I think Jared really highlighted some things that truly resonate with my own experience. You know, I think that, you know, we have a mutual trust, or I believe, a mutual trust and respect with our patients, and that's predicated on being in the, you know, in the trenches with them. And I think when you're in the trenches with patients, sometimes you know, a lot of the times there's this mutual respect and understanding about one another. So I also have been, I guess I should have known this, but I'm also surprised. I think many of my patients have come in and said exactly the same thing that Jared's patients have said, which is, you know, I'm not sure, I'll kind of wait it out. I'm a little hesitant because it may cause harm. You know, long-term, I hear the long-term side effects we don't know about. And I do feel that this is an educational opportunity and patients listen. You know, I say the same thing. Look, I got vaccinated in December when this rolled out at Hopkins. My wife is now vaccinated. You know, we know that there's true benefit here. There's very little risk. And it works. We know from the trials, at least, that, you know, patients that were vaccinated, you know, very few of them have been hospitalized, if any.
Yeah.
So I think that resonates with patients, and I think it's a testament to the relationship. And so I have had very little pushback from patients saying, you know, I'm just not going to do it. They really do trust what we say. And I think, again, this is predicated on a long and lasting relationship built on respect. So I've had a very similar experience and been very surprised at being able to turn the conversation around, and patients have gone and subsequently got vaccinated.
I do want to say something, if I could. We're taking this as assumed, and maybe it can be for much of our audience, but I want to be absolutely positive that something gets across really directly, which is so that those who are in the know about cancer, which say oncologists, oncology research, to those who are in the know about immunology, to those who are in the know about infectious disease, this vaccine is not controversial to any of us, right? So let's not talk about this as something nuanced with two sides. For people who know what they're talking about, the overwhelming opinion of pretty much every expert is that all eligible patients should be vaccinated, and almost everyone is eligible.
Right. That's great. I think we, you know, in our effort to just be respectful of all opinions, we probably shouldn't lose sight of there is a very clear prevailing opinion among people who eat, sleep, live, and breathe this stuff.